Hello everyone, my name is Anthony Albers. I'm an orthopedic surgeon at St. Mary's Hospital and an associate professor at McGill University, as well as an associate scientist at St. Mary's Hospital Research Center. My areas of clinical practice and research focus primarily on all facets of hip and knee arthritis treatment. Orthopedics is the treatment of musculoskeletal disorders, that is, the treatment of conditions that affect either the bones, the muscles, the tendons, the ligaments, all tissues that help us move. The most common conditions we treat are either traumatic, the result of an injury, or degenerative, meaning wear and tear. The most common degenerative conditions affecting the bones are osteoporosis, and the most common degenerative condition affecting the joints or the cartilage of the joint is osteoarthritis. Both conditions are the most common chronic conditions affecting Canadians after high blood pressure or hypertension. Nearly 1 in 5 Canadians are now affected by osteoarthritis, with most common joints being the hips, the knees, the spine, the feet, and the hands. Women are more affected than men, and the prevalence increases with age to the point where nearly 50% of people over the age of 80 suffer from osteoarthritis. My research focuses on improving outcomes and efficiency after hip and knee replacements. As our population continues to age and demand for surgery increases, we need to continue to deliver safe and cost-effective care while delivering excellent functional outcomes. This leads us to study things like enhancing pain control, expanding our day surgery program, which now accounts for almost 50% of our surgeries for hip replacements, and looking at mobile technologies to help move the episode of care from the hospital to home. We are also placing a large focus on health promotion and prevention to empower younger patients and potentially impact their outcomes of avoiding osteoarthritis in the future. We have done community talks, we've prepared outreach programs and virtual conferences to improve knowledge dissemination in our community. Our research program has also allowed over 50 trainees, students, residents, and fellows to get involved in clinical research, helping them develop into evidence-based practitioners and improve their careers. The results from our research are often implemented into clinical practice. For example, from our current work on the best way to control pain post-hip replacement, we found that local anesthetic infiltration by the surgeon is more effective than spinal anesthetic alone, and as effective or even more effective and more cost effective than regional blocks performed by anesthesiologists. Controlling post-operative pain is extremely important. It allows patients to get up and move faster and speeds up their recovery. It also allows them to get home from the hospital, even sometimes on the same day, and we now perform over 50% of our hip replacement surgeries as day surgeries. When patients go home the same day from their surgery, we leverage a mobile app called My Mobility, which helps them with the recovery process at home. A recent study that we conducted showed that this app is acceptable and useful in a diverse patient population of outpatient hip and knee replacement patients. Here at St. Mary's Hospital, we have the luxury of being a small hospital in terms of size, but we're actually the largest volume hip and knee replacement center in Quebec. This speaks volumes to how our clinical and research teams have worked strongly together to create an efficient surgical flow despite the limited resources of our Canadian healthcare system. This also allows us to create appropriately powered research studies, given that we treat a high volume of patients with a tight-knit team. We hope to continue our research to bolster our cutting-edge clinical program, and we are looking into novel ways to improve patient experiences, including different modalities for post-operative pain control, including augmented reality and music interventions. We also have collaborations with our geriatrics team and are trying to leverage digital technologies to improve perioperative care.